Hey everyone, today we're going to be doing a PRP treatment on our patient, otherwise known as platelet-rich plasma. We've already drawn her blood and spun it in the centrifuge for about 10 minutes, separating the white blood cells, the red blood cells, and here we have the most potent part of the blood, which are the platelet-rich plasma, which Dr. Hanna will be injecting into our patient this afternoon. Previously, they've always used PRP for medical, for patients with arthritis, athletic injuries, but of course now we use it in the cosmetic field. So about 4 to 6 weeks, this patient will start to notice a natural tightening in the skin, a natural plumpness. This treatment also does help to stimulate new collagen, so many of our patients use it for acne scarring, which we could also combine with micropen if we wanted. We also can do this for hair restoration in men and women. So stay tuned for this afternoon's treatment.
The PRP, or the platelet-rich plasma, can also be combined with the filler to make the filler lasting a little longer. So we have a natural component as well as the artificial component of the filler. We will inject it here in a similar fashion to the filler, just to augment slightly the cheeks and just make that apple more prominent. Look at the difference between what we have done on the right side of the cheek and what's on the left side of the cheek. You can see where I actually put my injection, and usually just by 5 seconds that will stop completely, and you can see the effect of that round forward or the anterior projection of the bone, how useful it will look compared to the other side. We have contoured the front of the patient cheeks and made her a little bit more useful, and I hope you appreciate that when you're looking at the face. That is usually done at times when you're doing the facelift by putting an implant, a cheek implant, but also if you're not doing that, we can simulate that cheek implant by putting the filler or the PRP by itself. Will not be a bad idea when you actually use the plasma just into the crevices of this. And you can use here as much as you can, contrary to what we can use from a filler for a limited amount to smooth that out. And that's what we're going to be trying to do in her situation. I'd like really to smooth that dip out. Tell me what you see difference.
Oh, immediately above between my forehead.
So you can see this is nice and smoother now with no reflection coming to the light. So even the 11 signs that were kind of like hanging out there, we had no problem putting as much as possible, filling that area without being limited to the small amount that we can do with the filler and also the worry about a filler. And we kind of like poked out the cheek here, made them a little bit up, a little bit younger looking here, and you can see that there is no much bruising because the plasma has got components that will control the bruising and heal it by itself. So even from the injection where I actually poked you, whether around the chin, around the corner of the mouth, on top of the mouth, or at the jawline, it appears that you're looking really pretty nice without any black and blue marks. So this is really a good treatment without having to worry too much about the bruises. So if I'm having a reunion or a function, I would rather have the PRP rather than venture with a filler where I can be black and blue. So, and that corrected really nice. It really nice, made a nice flow to your chin area, to the jaw area. We didn't plumb you very much at the top because we want really just to keep the balance between the upper lip and the lower, and overall it looks pretty nice. I hope you like
Yes,
it.
I do. Yes, a lot.